Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Eliza Humphreys. She is a pediatrician and a life coach. She wrote the Kevin MD article, Who Will Heal the Physician? Eliza, welcome to the show.
Thanks, Kevin. Thanks for having me. I'm happy to be here.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Sure. As you said, I'm a general pediatrician. I trained in California at UCSF for medical school and my general pediatrics residency. Following that, I went and did a preventive medicine fellowship, which involved getting an MPH also in California. About 15 years ago, I moved to Massachusetts from California, and I've been in a private practice north of Boston practicing since then. And during the pandemic, I became certified as a life coach.
So tell me about that journey. What made you decide to become certified as a life coach in the midst of your busy pediatric practice?
That's a good question. So while my office never shuttered its doors during the pandemic, our volume was really greatly reduced, and I'm part of a mid-sized, very busy private practice. So when our volume went way down, we kind of cycled who was in the office, and I found myself with a lot more time when I wasn't trying to contribute to my children's remote learning, which I found I wasn't necessarily very proficient at. I was delving into other things that were available, and I found myself just kind of almost accidentally attending a summit called the Leverage and Growth Summit. And during that, it was a kind of a free online series of webinars. Actually, I think, Kevin, you were one of the speakers on the original one that I attended. Encountered quite a few coaches and got curious about what that was like, ended up being the beneficiary of some physician coaching myself, and that kind of led to my own path of becoming certified because I found it so transformational and helpful in terms of both my professional practice with patients and in my own personal pursuits.
So tell me, how is your life coaching practice? You said that has helped you professionally. How has your life coaching practice helped you professionally?
Well, initially, when I say it helped me professionally, some of the coaching is really an examination of thought processes that contribute to behaviors and results. So, a lot of what we do in clinical practice is teaching and encouraging behavior change, whether it's nutritional and lifestyle modifications for our patients and their families, or adolescents who you're encouraging not to vape, or any number of kind of clinical scenarios in which you're really trying to motivate behavior change. Having some of the coaching tools and modalities is, I found, really helpful. It was much easier to connect with patients and kind of hear their priorities in a way that allowed more space for change and actual real change. I think prior to coaching, I had my own agenda, and I was very intent on kind of pushing my agenda through our time in the exam room. And unfortunately, that doesn't necessarily get results. I also took it very personally, I think, when clinical outcomes wouldn't necessarily reflect what I had intended. And so I think through the coaching process, you're examining your own thoughts, but you're also able to work with someone else's thoughts and where they are and kind of see that in a different perspective, which ends up enhancing the connection between patient and provider. And in clinical practice, like, that connection is everything. Our whole professional work is basically based on the connection we have with our patients and the continuity over time. So that's what I say. It really enhanced my professional kind of tool set.
All right, let's talk about your Kevin MD article titled, Who Will Heal the Physician? Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, sure. Thanks for asking. So I think, again, on this theme of having a hidden upside to the pandemic, I know it was a really stressful time for many, and certainly those in the front lines and the ERs and ICU. But as I say, I had a little bit more time on my hands, and that time provided more time for reflection and kind of investigation of where I was in my own clinical practice and mindset. And I became very interested in the role of uncertainty and risk in clinical practice, specifically how unexpected outcomes and medical errors impact the individual clinician. And the article is sort of my own personal essay or reflections on that journey. And I ended up kind of doing a deep dive into some of the work that had previously been done, and then my own kind of digestion of that. And I ended up in the article with 4 main points of ways to combat some of the discomfort that arrives from unexpected events in practice or medical error.
So before getting into how to combat that, go into more detail about how a medical error or a liability lawsuit arises from that error. How does that specifically affect clinicians?
That's such an important question. I think obviously there are individual variations, but overwhelmingly unexpected events and errors are devastating to all involved. I think first and foremost is tragic for the patient, but as I explore in the article, I mean, there is this entity of the clinician involved, the physician involved in the medical error, who is also very wounded by a bad outcome. And so Albert Wu, in his 2000 BMJ editorial, coined the term second victim, which may be familiar to your audience, but may not be. I really wasn't familiar with it before a few years ago. And that second victim would be the physician who is involved in an unexpected or bad outcome, who then endures a series of really negative consequences. So that might first be rumination, second guessing. It kind of ends up then going into self-doubt and questioning clinical competency. It could end up leading to anxiety, depression, ultimately. And some of this work about the pathway that a clinician would take after a medical error or unexpected event is really delineated by Sue Scott out of Missouri. So there is kind of a predictable pathway that a clinician will go through, ultimately leading to either moving on or removing oneself from clinical practice in more severe instances. But that is part of the kind of the specific journey that can happen. The liability you mentioned, I think, is a very real aspect, unfortunately, for anyone in clinical practice. I think the numbers are quite astounding, and that, in fact, one of the articles referenced in the article in Kevin MD is that over a career span, upwards of 2/3 and possibly even more, depending on your specialty, whether surgical or not, may confront a medical malpractice lawsuit, which, as we all know, can be incredibly distressing for those involved.
Now, what are some of your suggestions in terms of how clinicians can combat some of the effects of this proverbial second victim syndrome?
So I think the first is just to recognize it. I think no matter what language you use, I think recognizing that for an unexpected outcome or a medical error, certainly it's very tragic, but that the patient is one side of that. We need to also recognize the care providers who are involved, and that may be all members of the medical team. And so just awareness of that fact, I think, is very powerful. I think the literature on self-compassion and how useful self-compassion tools are to individuals in the healthcare profession is also really important. So by self-compassion, I'm referring specifically to, Kristin Neff, who's one of the founders of this topic in literature, and she defines self-compassion as basically treating yourself as you would treat a friend. And there are 3 pillars to self-compassion. 1 is kindness, as in kindness to yourself. 2 is mindfulness, so that's kind of awareness and acceptance of the circumstance. And the 3rd would be common humanity, so acknowledging that as humans, whatever we're experiencing has been experienced by someone else before, and there is some potential for healing and recognizing that. And then another aspect of, one of the combatants to the second victim syndrome is on the institutional level. So in the article, I mentioned briefly one of such programs at Mass General that was founded by Dr. Joe Shapiro. So it's a peer support program, and its aim is to change the culture of medicine after an unexpected event. And so there's, a group of trained peer providers who are available for more of a therapeutic interaction with the clinician involved in such an event. Finally, I think physician coaching, we talked a little bit about, but I think that can be very useful to just acknowledge how our thoughts about ourselves directly affect how we feel about ourselves, which in turn kind of drive our behaviors and actions, which lead to our results. So, that's a very powerful tool in terms of managing, how we're dealing with such challenging events.
Let's say I'm a clinician listening to you in this podcast and unfortunately going through an adverse event that may have arisen from a potential medical error. What are some immediate next steps you would recommend that this clinician do?
That is a really great question. I think there are many things to do. One is to find immediate support. There are definitely people to talk to. There are usually institutional people available. There's your risk management team. There are coaches like myself dedicating their time to people experiencing such events as well. I think, there's the immediate, what do I do next situation? And I think that is very clear. You can deal with your malpractice carrier, you can talk to the risk management. But I think after that, immediately, who do I call first situation, it's more of how do I take care of myself? And I think that's really crucial. And so some of these self-compassion tools can be really instrumental. A lot of clinicians may experience kind of that fight or flight response and be feeling very distracted, not able to sleep, not able really to focus on their other clinical duties. And so it's really important to take a step back and do some self-care in that situation. I think also, unfortunately, there is a code of silence, and certainly if there is impending litigation, there are some sensitivities around disclosing events of a specific clinical situation. But as much as we can connect through other colleagues, it's really important in terms of providing a safe space for healing after this type of situation.
And when you refer to self-compassion and self-care, what exactly do you mean by that? Can you give an example of what that would look like?
Yeah, absolutely. So again, the work I am referencing is mostly that of Kristin Neff, widely available tools, accessible to all. So just that's a name to remember if people are looking for more information. But it's literally things like, how are you talking to yourself? Mm-hmm. Are you saying very harsh words of criticism? Why did I do that? How could I have do that? Ruminating on the error or potential error you're perceiving. Research has shown that often we will distort reality. And so you're not necessarily in your right mind if you're, again, in this sort of negative filter. Really important for self-compassion to acknowledge that this is just a difficult situation. And so literally taking a step back and telling yourself, this is really hard. This has been really distracting for me. Kind of removing yourself in a distanced way to acknowledge how difficult or how stressful something might be. And even that can provide some relief. Again, recognizing that there's a common humanity element. So, other people have faced challenges like this as well. And so how you talk to yourself may in turn allow you to better see opportunities for other potential interventions and healing. So that's one practice. Everything from calming your fight or flight reaction as well. So there are even deep breathing techniques, meditations, body scans, trying to process the feelings that you may be having in your body to recognize what they are. And so there's some work around those types of things and many others, in fact, if you're interested in pursuing this further.
We're talking to Eliza Humphreys. She is a pediatrician and life coach. She wrote the Kevin MD article, Who Will Heal the Physician? Eliza, what are some of your take-home messages that you want to leave with the Kevin MD audience?
I think a take-home message is that this is a near universal experience for anyone in clinical practice to have an unexpected outcome or some form of error at some point in the career. And many may face even a medical malpractice case over the course of a career. And there are two tools and practices to get through this and to relieve some of the distress. And I feel like we should be learning these alongside anatomy and pathology in order to remain happy in practice.
Eliza, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you, Kevin.